Good day, everybody. Welcome to Dental Voice Season 2. My name is Rolando Mia, and this is Zyris. Dental Voice is intended to give people a perspective on clinicians, what they're dealing with, and the real stuff that's going on with regard to COVID and everything we're going on. Today, we have a very special guest, Mira Giulietta, who is a D3 or third year student at the Herman Ostrow School of Dentistry at USC. Really excited to understand what she's dealing with and then also have her share her perspective on kind of the effect that COVID and everything is to her. So Mira, it's a pleasure to see you. Thank you for joining us. How are you?
I'm fabulous this morning. Thank you.
Fabulous. Oh, awesome.
So I'm good.
So I'd like to start by kind of getting your perspective and kind of getting your experience. When you entered into dental school, COVID didn't exist. Now that you're entering at your third year, and the third year is when you start getting your clinical aspects of dentistry and working on patients and the effect of COVID. How are you feeling about that? What's going on?
It's such an overwhelming feeling, to be honest, to deal with all these factors. Firstly, it was completely unpredictable. As dentists and clinicians, we're encouraged to be in a very kind of high volume, fast paced environment constantly. And the 2 years that we spent in sim lab, we had to get used to people around us constantly, and sharing a space in a way that would accommodate, a collective environment of learning.
Right.
With this, it's just, I don't know, it's hard to deal. It's hard to deal with a pandemic, it's shocking. This is going to be a historical moment in time. And I don't know, I think everybody's anxious about it, but it's just about how we adapt, as medical professionals, we need to adapt to something like this. So looking ahead is important.
Well, it's amazing because, with COVID, there's so many things that are out there. When you look at Dental Voice, one of the things we're kind of focusing on is what's real and then what's speculation. You're getting bombarded with so much. How do you personally separate what to listen to and pay attention to, and then what's just people freaking out about stuff?
I mean, that's really, you have your own personal ways of dealing with these kind of things, personally, and I won't speak for anyone else when I say this, but daily stresses in life are just, a way of living. You have to deal with things. You have to adapt to, in LA, I have to adapt to traffic, I have to adapt to plenty of things, This is not the same as traffic, but it's something that we need to look forward and find a solution for instead of kind of indulging in the anxieties and tribulations of it. You see what I mean? I think as a professional, it's our duty to be part of the movement of pushing the envelope and moving towards how we can work through a pandemic. Do you see what I mean? As opposed to just kind of hiding away. Yeah, exactly. Being scared and sensationalizing or listening to news. I try to really not listen to too much news, to be honest, on if it's not what I consider factual, if it's just people speculating and talking, I don't think it's productive, So I do think to stay positive is good, to stay grounded and remain compassionate as a medical professional. Understand that, at the end of the day, you signed a HIPAA, you signed an oath to help people, help your patients and be there for your patients. So regardless of a pandemic, your patients are always going to have dental issues to deal with. Should we as a dentist be like, oh, no, I don't want to see you, I'm scared to get a virus from you, I don't think I don't think that's productive. You know, I personally feel like we should remain professional and learn how to create those barriers to protect everybody that's in that environment. So that's my opinion on it. But
Well, thank you. Thank you for sharing that. And I love the feeling around that, because as you mentioned, it is about the patient, and it is about the commitments that you've made.
yeah,
When when you consider all the unknowns with this COVID, what we do know is that it is incredibly it's virulent. In other words,
yeah.
not really quite sure. How do you feel about, entering into your third year, and now the prospect of actually treating patients, and there isn't? Do you feel, how do you feel about that?
Well, you know, I don't want to say I'm a superhero and I feel like I can do it, you know, because there are obviously anxieties that come with knowing that you have to deal with an entire different system of working now. You know, your barriers and your PPE have now increased. So, you know, I went in for my N95 mask test fitting a few days ago, and you know, I'm not going to lie to you. Having those masks trap my face in such a way, I didn't feel great. You know, I didn't feel great about it, but I knew that this was something necessary. These are the steps and adaptations we have to take as clinicians to deal with this and get to the point where we are helping patients. You know, we want to protect our patients. Our patients are our number one concern. Also, our own health is our number one concern, because without our own health, we can't help other people. You know, so I think it's our responsibility to just take a deep breath and educate ourselves about this virus, and come to terms with how we can adapt our own behavior and our practice around this pandemic. You know, so that's all we can do. You know,
That's cool.
Um,
I
yeah,
I love the pragmatism around it. Now, i- in looking at this,
yes,
one of the key things, and it started and continues to be a very, very hot topic, is this issue of aerosols, and
yeah.
this issue of them kind of spreading. How
Mhm.
do you feel about that? What do you know about that? And I mean, as you enter into the clinics, I mean, you're going to be exposed to an entire area. What are your thoughts on that? What have you learned about it, and kind of how you're preparing yourself for that?
Yeah, so I don't know if people are familiar, but I go to University of Southern California. So we are a school that learns through the PBL system, which is the problem-based learning system, not through lectures. So we're very hands-on with the way that we learn. We learn through case studies, and a lot of our case studies have actually been. I think actually coronavirus did come up before the pandemic even happened. I do remember studying a little on coronavirus. And the thing about dentistry in general, dentistry is, you know, you're exposed to everything in dentistry. You're exposed to fluids, you're exposed to aerosols, you're exposed to almost everything the body can give you. It's coming to you, you know? So it's very important to understand how to minimize transmission. You know, in a dental clinic, you have to have a very well ventilated environment for starters. Air filters, special air filters are necessary. You need to know how to protect your patient and protect yourself with the appropriate PPE that covers the areas of your body that could absorb these aerosols. Um, you know, masks, goggles, but also, you know, a vacuum kind of system for the saliva that is minimizing because when you're using a drill, you know, it's really going everywhere. So you want to be able to have a system where you're minimizing saliva um, evacuation, right? So there's so many different ways. We already Dentistry already had this in place. You know, we already had a system to minimize aerosol distribution. You know, it's just we kind of have to take it further now, you know, because this virus is obviously a lot more spread than we anticipated, and the spread is a lot, you know, easier than other viruses. You know, through the touching and then touching your face. That's something that you know, right, exactly. So yeah, it's just a matter of us kind of increasing our awareness and just putting in better ways to minimize that. But I think we can do it. If anyone can do it, dentists can do it. I'm hopeful. I'm hopeful.
Now, do you have you've got a real positive perspective around that? Do you have any fear or apprehension? I mean, kind of lurking in the back of your head with regard to uh-oh.
Yeah, so Rolando, yeah, absolutely. It would be, I think every human does, you know. I don't, as I said, you know, I don't want to say that I'm a person that's like a superhero, like I'm not scared of anything, you know. I'm obviously, you know, a little bit fearful of how we're going to do this, how we're going to minimize this situation and get the best outcome. But I think that we need to start by thinking in a rational, clear manner. And the way to do that is to kind of keep our anticipations at bay. Try to see the logical and rational way to deal with a situation like this, because we have to deal with it at the end of the day. I mean, what are we going to do? Just not be dentists? You know, we have to be dentists. That's why we signed the oath. That's why we went to school. Pandemics have happened in the world throughout history, and they've been devastating, and it's incredibly scary, you know. But just like things like war and pandemics, and we're humans, we're survivalists, you know. We have to survive, so we have to find a way to survive. And so looking forward and having a positive outlook and educating yourself, understanding there are ways we can deal with this is just the best we can do right now, really. So
Awesome, thank you. That's awesome. No, that's so cool. The perspective is so huge. It's great. Do you see the same feeling with your colleagues, with your students, the other D3 or students at USC, and you know, are you feeling the same sentiment, or are you experiencing others who are actually, you know, have anxiety and are feeling uncomfortable?
yes, I am. And I personally have absolutely nothing bad to say about my colleagues. I go to an incredible school, and my faculty are unbelievable. My colleagues at school as well are incredibly hardworking. I mean, we have a lot of people in our class. There's kind of divided decisions on this. You know, some people, they want to stay home, but they want to stay home for the sake of their families, for the sake of protecting the people around them, and that's perfectly understandable. I have absolutely nothing against those people. You know, if that's what you need to do to protect yourself, that's what you need to do, you know. Then you've got other people in the class that are incredibly anxious to get in back to school. You know, they just want to, you know, coronavirus is a concern for them, but they're like, you know, let's be strong, let's go, you know. So it's that fight on mentality, really, isn't it? We, you know, USC is a very incredible place, and everybody's going to get there. You know, it's just some people will take more time than others, and that's perfectly fine. We just have to be mature adults about it, and we have to find a solution, you know.
So you fall in on the right camp, which is, we got to do this, we can do this, let's figure it out. And I think that's so awesome.
I think 100% go back and forth on it. Like I'm in the camp where I want to find a solution, but I feel we should take time to find the best solution, you know, because it's one thing, you know, getting in there, but how much do we actually understand this virus? How much do we actually know how to deal with this virus? So I think educating ourselves to a point where we're confident that we can actually execute dentistry in the safest manner possible is the aim, you know? So, yeah.
Cool. That is so cool. So have you always wanted to be a dentist?
No.
How did you end up? What's the journey that brought you here? And then, more importantly,
Yeah.
in that journey, there was a kind of a mindset around becoming a dentist and going to dentistry.
Yeah,
Then, out of the
absolutely.
blue, COVID hits it.
Yeah.
Now, all of a sudden, there's this variable that nobody, I mean, nobody had any idea was going to happen. How's
Right.
that? What's your journey? How did you get here, and how you feel about all of this?
Wow, my journey's a wacky journey, I can tell you. Okay, so I mean, I don't know if the viewers can notice my British accent. I know it's fading a little bit. I am actually from London, England. That's where
You could say the alphabet, and I'm happy to listen to you.
lots of people think Australian, so I'm just going to put it.
Australian.
I'm British, and I'm from London. And yeah, so I can actually hear myself. Can you? Is it
No, you sound fine.
really okay? Um, so I came over from England 6 years ago. When I was in the UK, I had quite a lot of dental stuff done to me. So, for example, I had maxillofacial surgery when I was around 19 years old because my occlusion wasn't correct. And then I had braces, and then I had just a ton of other dental stuff. And I remember during that time, I've always been a very creative, artsy human being. Like when I was young, I made a lot of music. I was a singer for a long time. I played the guitar. I played quite a few instruments, actually. I was very artistic at school. But I really loved humanities. I loved English. I loved to write. I loved to speak. I loved to act, you know. So dentistry was just not really in the horizon for me, you know. My sister went to medical school, and I was just like, God, I don't want to do anything medical. I just don't, you know. But, you know, I do remember having this experience as a child where I had a lot of dental issues, and my dentists or the specialists that worked on me, because at the time it was an orthodontist and an oral maxillofacial surgeon. And these two were husband and wife, by the way. What a team. Wow.
Right.
These two were like superheroes, you know, and I had all this stuff done to my face. And they I just looked up to them a lot. I was like, wow, I could do this. I want to do this, but can I do it? That was the question. Can I do it? I didn't think I could, to be honest. So when I came over to the US, 6 years ago, I moved here with a kind of blank slate. I had a degree in anthropology from University College of London because I was massively interested in cultures and art and religion. And then I thought, you know, what do I really want to do that I can help people, you know, and I can make a difference, but also have a personal relationship with whoever I'm seeing, you know. And when I came across dentistry, it's so funny, and I don't know if the person that helped me make up my mind about it, I talk about her all the time because she's honestly such a big inspiration for me. But her name is Madison Koenig. She goes to UNC in North Carolina because that's where I was when I first moved over from the US. And I literally met her in a bar. She was my barmaid. And she said to me, I'm going to dental school. And I was like, oh, okay. What's that like? And she's like, dentistry's the best career. It's artsy, it's hands-on, it's sciencey, it's everything. And I was like, oh, you know, because I'm kind of on the fence about what I want to do. So let me look into dentistry. And I threw myself into shadowing. I actually shadowed hundreds of hours at various different clinics around Greensboro, Durham, North Carolina. And I was just so inspired by dentistry. I was like, oh my God, they're doing surgery every single day. They're doing something hands on. You know, it's not like being a doctor where it's very diagnostic and it's very kind of
Yeah.
theoretical to start, you know? Dentistry is your patient comes in, you take radiographs, you may find things that need treating, and then you're right in that mouth, you know, with a drill or with a scaler, or you're doing something, you know. And this was the artistic component for me, you know. This was the hands-on component that I liked. And then as I was going through dental school, I realized I wanted to do cosmetics, because cosmetics is so, you know, you need an eye for it. Like, it's very artistic. Like, you're looking at someone's face, you're analyzing their face, and you're trying to find teeth and a smile that would suit their personality, that would suit them, you know. So cosmetics was something I geared towards. And by the way, I do want to shout out to a huge inspiration of mine, Dr. Mark Hyman. He was a dentist
From Chapel Hill.
From Chapel Hill, yes.
Yes.
He was
Thank you, Dr. Mark.
Thank you so much, Dr. Mark. He is a dentist that I shadowed extensively in North Carolina. He really made me excited about dentistry, I have to say. He showed me all the kind of tricks and kind of taught me how to be patient, and he, just watching him was such an inspiration, because the way he was with his patients, so warm, you know, so welcoming and easing their anxieties. Because I think a lot of people, even dentists, have anxieties when they go to see dentists, you know. It's an anxious kind of field. So it involves a lot of trust. And I think Dr. Mark Hyman really encouraged me to feel at ease with my patients and see them as people that, you know, are coming in with an apprehension. And it's your job not only to do dentistry on them, but to make them feel comfortable and to trust you. And
that's so cool. By the way, I have an incredible amount of respect for him. I love him to death. Don't let him know. I want him not to know.
He's not watching now. He's not.
No, so it sounds like you were able to kind of marry some of the things that you absolutely love and adore, and get into a profession that enabled you to not only apply it, but also the sentiment around being able to help people, and tying it back to your experience with the husband and wife team that were with you. That's incredible. And yeah, so here you are, you're going into third year, you're going to be a dentist, and you're going to be going through all of that. What's the hardest thing you've had to face navigating through this? And, you know, there are a lot of people out there who are considering dental school.
Right.
What would you
COVID, Rolando? Wow. So yes, my advice to anybody, and I may be a little biased on this, but my advice to anybody out there is dentistry is a fantastic career. It really is. And coming from a background where I just didn't want to do anything sciencey, I can tell you that the transition from even something artistic or something creative to dentistry was just very easy, you know, because dentistry is that perfect mix of doing something that is medical, doing something that is helping people, doing something scientific, with something that is artistic in a way, you know, because every day you are kind of drilling a tooth or working on a tooth, but you're kind of shaping it towards what suits the patient. You know, you're sculpting it, you're morphing it, you know, in a way that there's just so many elements, and it doesn't even stop there. You know, even with the specialties as well, it's, you know, with orthodontics, you have to understand, you know, orthodontics is kind of there's quite a lot of physics involved in orthodontics too, you know, because you're kind of calculating what tooth you have to move to create the best occlusion. And it's just such a great area. And if you're one of those people that really likes to be a master of few things and like interested in a lot of things, but really like to throw yourself into one thing, the mouth is just an area that you can focus on with dentistry in like to a very detailed level, you know, so it's not, you don't have to really concern yourself too much with what's around. I mean, you do, you need to understand systemic issues and stuff like that, you do, but at the end of the day, this is your place of work, you know, the mouth. So you're a master of the mouth.
A master. I love it.
Master of the mouth, yeah. So yeah, I love dentistry. I really do. It's beautiful.
So what would you say
Yeah.
are the top 1, 2, 3 challenges that you're facing right now with regard to just continuing through dental school and then with this whole COVID or whatever hanging over you? What are the top 3 challenges you're facing at this moment?
Yes. I think, okay, the first challenge is kind of understanding how the field of dentistry is going to adapt to this situation and the longevity of the adaptation. Like, for example, I'm not excited about the idea of wearing a huge amount of PPE. You know, that doesn't excite me. I don't want to have to walk into work in a spacesuit, you know, like who wants to do that? But, you know, at the end of the day, it's for the good of the patients, we have to do it. But it is something that's a little bit of apprehension to me. You know, I don't particularly want to be in a position of discomfort when I'm working on a patient. You know, my wearing a lot of goggles and protecting my mouth so much, or being in all this gear, could minimize, you know, my own comfort. And because of that, how is the quality of my work going to be compromised? I have to be able to work under these kind of stringent conditions, you know. So it's important to, yeah, I mean, that's one apprehension. That's one apprehension. The second apprehension is probably how many people are going to want to see dentists in the future now. Obviously, dentistry is necessary on an emergency level. But really, if you look at, so, okay, you know, I come from England, right? So the English have a kind of different perspective to dentistry that the Americans do, in a way. Americans are what I would call very extra about dentistry, which is great. I love that. I've always been extra about my own dentistry. I, you know, consider my oral hygiene to be extremely important. And if anybody spoke to me, I would tell them that, you know, the mouth is absorbs everything. You know, you eat with your mouth, you breathe with your mouth, you kiss with your mouth, you do everything with your mouth, you know. So it's so important to keep that area clean, you know, for the sake of your future and your future health. So, you know, keeping up with your dental work is something that the Americans do very well. The British, not so much, you know. It's not, some British do, but on, you know, for the most part, it's considered something you do when you have an emergency. You know, I have tooth pain, I go to the doctor. I need an extraction, I go to the doctor, you know. But if I had fillings or cavities, I don't know if I would go, you know. So it's a lot extra here, you know. But is that mentality going to shift a bit? Are people going to be like, you know, is it worth going to see a dentist now because there's a pandemic, you know? My answer would be trust your dentist. That's my response, you know. Trust your dentist. Trust your dentist is making taking the most precautions to keep you safe. That's the ultimate thing, you know. And take care of your oral health, because your oral health could ultimately affect your immune system and how you deal with systemic diseases from that day forward. So I would try to keep that mouth as clean as possible. But I'm recognizing that an issue would be people having apprehensions about seeing the dentist after this pandemic. Thirdly, what can I say? I would say just how many people, possibly how many people would want to be a dentist in the future. You know, is it something that, again, because we deal with a lot of aerosols, etc., are people hesitant to pursue this as a career? Do they want to do something more, where you're exposed to less? So that would be my third one.
Cool. Thank you for that. It's pretty cool. The perspectives of people vary, but the sentiment behind and the feeling that you get is that there's a balance. You clearly are a little apprehensive, and you recognize that
Absolutely.
COVID is here, but it's not ruling your life, which is pretty cool. And it's forcing us as an sorry, as a country and as a profession to upgrade. So that's pretty cool.
Yeah.
If you were to kind of sum up, and for our viewers, for some of the other dental students that may be out there watching this, for people who will see it later on,
Mm-hmm.
what kind of advice or closing words would you want to give them with regard to dentistry, about going to dental school, and then also this whole pandemic thing where there's a lot of unknown, a lot of uncertainty, a lot of speculation out there. What words would you want to share with our viewers?
Well, I would say, at what it boils down to is you doing what you're comfortable doing. No one can make you feel bad for the anxieties that you feel regarding this pandemic. It's not a small thing. It is a big thing. A lot of people have lost their lives because of this virus. So absolutely keep yourself safe. Um, I think I personally would say that when you become a medical professional, you do kind of have somewhat of a responsibility to care for your patients. That's why we chose the medical profession at the end of the day, and we didn't choose something else. So being open to adapting to this situation is very important. Staying strong and staying positive and educating yourself as much as possible on how to deal with a virus of this extremity is important. So I would say, just stay calm, do some yoga and take a breath and just, do what makes you feel comfortable. Don't push yourself, but get to a point where you feel comfortable enough to do dentistry, what would make you comfortable? Make that clear, you know. But I would advise against kind of hiding under a rock and waiting for this to boil over, because there's people that need us, There's people that really need us. So yes, that would be my advice. But as a whole, I just want to put out there, I want everybody to stay strong and just stay positive and take care of yourself, take care of your own mindset and mentality. And then you're going to be able to go out there in the world and be the person you are without feeling the anxiety. You are important. So self first.
Thank you for that. Thank you. I love that. It's, we have a colleague here. Her name is Dr. Binti, and this kind of makes me smile. Believe in the profession. You clearly believe in the profession. I think that's great.
I do. Thank you
And,
so much, Binti. I appreciate you.
well, and then we've also got our friend Dr. Hyman over here.
My favorite.
Yeah, he didn't go to Wake, but that's okay. I still love him. So. So if people wanted to get in touch with you or ask you questions or wanted to send you a message, what would be the best way to do that?
Instagram is my point of contact, I would say. So do you want me to say?
Yeah. Yeah. What is it?
So it's at Dr. _Mira, Mira _Giulietta, like my name. That's Giulietta, and then another underscore. And
you like those underscores? No.
I do like those underscores. I did have another account without the underscore at the end, but that account got hacked. So it's the underscore at the end that is my current account. So please do reach out. Any advice I can give you, I'll be there for you.
Fantastic, and thank you for that. And at some point over here, as you maybe enter into the third year or fourth year, and you start experiencing things, would you be willing to join us again on Dental Voice and kind of share what you're experiencing, what's going on? Would you be up for doing that again?
Rolando, you don't have to ask me twice. I would love to.
Cool.
I love speaking. So please have me on here again. And I just want to also thank you. You've been fabulous, and you've really, made me feel great as a guest on your show. So I'm looking forward to, if you decide to reach out to me again, I would love to be on your show.
I don't know. We'll see.
Hopefully I'm not too British.
I just like the British.
Well,
I'm not gonna try to mimic the accent, because I'm gonna get all sorts of you for that. So those of you who are watching, if you like this and if this is important, please, if you have questions for Mira, please reach out to her. She gave you the Instagram message, or send messages to us, and we're more than happy to get them to her. If you like this content, please share it. If you have questions about other things or would like us to cover other things, please let us know. Again, we very much appreciate you joining us. Love to hear the messages that clinicians and I mean, this is real experiences, and it's really, really heartening to hear the positiveness and the support behind it. So Mira, thank you so much.
Thank you.
Appreciate it. Good kick butt, break a leg, or break a tooth, or I don't know, as you enter into third year. And USC is our alma mater. Dr. Tom Hurst, the inventor of our system, graduated from there. So is our team. So excited about that. So thank you so much. Please be safe. Have a great rest of the week, and we'll see you soon.
Okay. Bye-bye.